It is more and more difficult today for physicians to sustain their practices than ever before.
We find ourselves in an era when the pace of change in the delivery of healthcare in our country is perhaps as rapid as it's ever been. The Physicians Foundation is in a unique position because of its totally undistracted focus on issues that affect the environment that physicians practice in.
The Physicians Foundation was formed in 2003 to help physicians maintain the viability of their medical practice in these days of uncertainty, and to look at some specific issues.
I think it's our role to bring those issues to light and to give people the proper knowledge and information they need to make decisions that in the end will be most important for patients.
Physicians and patients alike need to be aware of changes that are happening in society during this critical time.
This is why the Physicians Foundation created the watch list. These are the issues that are going to be important in the coming 12 months. The uncertainty that is associated with the Affordable Care Act flows from the fact that this is a 2,700-page bill that has already spawned 13,000 pages of regulations.
Physicians don't know which way to go. They're small business owners, many of them, and they just don't know if they're going to be able to remain viable in an environment of increasing regulation and decreasing reimbursement.
With the looming aspect of healthcare reform and all the administrative burdens that are being placed on practices, is that it takes more and more time out of the physician's day to deal with data and information and requirements.
Studies show from the Physicians Foundation that 22% of a physician's time is now spent on non-clinical paperwork.
This is a real concern because it affects the efficiency and the cost effectiveness of what we do.
This tremendous rush, which is being fostered by the Affordable Care Act, into bigger and bigger systems, there's no evidence that they're better. And in fact, there's some evidence that we're going to raise costs and perhaps even lower quality.
We have a situation where smaller practices are being forced to be absorbed into these systems, not because they can't provide high quality and cost-efficient care, but merely because the specter of a huge monopoly in a geographical area leaves them no way to compete.
There are a lot of physicians who are essentially giving up the private practice model because they can't make it work fiscally. And in joining a larger group, we're very concerned about the loss of autonomy we have with our business and with our patients.
It's very important to me in my practice to be able to make independent decisions that are in the best interest of the patient.
Any loss of autonomy, any intrusion into the physician-patient relationship really diminishes our ability to deliver healthcare appropriately.
We are in the middle of a physician shortage right now as we speak. We are training the same number of physicians each year that we trained since 1996. During this period of time, the population of the United States has grown by 50 million people. And then we add 30 million new patients to the rolls. Will these patients have a doctor to see?
Losing 40,000 physicians, gaining 30 million patients is a very difficult equation to approach. We need to be aware of it. We need to be making plans for it. We need to be addressing it in as many ways as we can.
2013 is a watershed year and important because in 2014, the bulk of the Affordable Care Act will start to kick in. Physicians Foundation is positioning itself and its resources to help doctors, to help their patients.
I'm optimistic about the future because we have so many energetic physicians and medical executives on the Physician Foundation board. The biggest challenge we have is to make sure that the policymakers in Congress understand and are cognizant of these issues. I think that is a terrific challenge for us.